My name is Scott Ackerman, and I'm a radiation oncologist here in Jacksonville, Florida. I see lots of kinds of cancers in my practice. I see lots of patients with so-called colorectal cancer. Now, colorectal cancer is cancer of the colon and cancer of the rectum. Now, when someone's diagnosed with cancer of the colon, generally a surgeon goes in and removes that part of the colon. But rectal tumors are a little bit different. They're a little bit more difficult because these are in this area of the colon, which, by the way, is a more common place for a tumor to be in the colon and rectum, is in the rectum. But this area is difficult to remove surgically and avoid having a colostomy. Most patients, that's what they fear the most. If they have rectal cancer, they're afraid that if they have it resected, they're going to wind up with a bag, with a colostomy. So what we have found is that if a patient's diagnosed with rectal cancer, that if we give radiation treatments before surgery, we could do two things. We could downstage the cancer and increase the cure rate. And number two, and this happens to be as important, if not more important to most patients, is improve the resectability and make it easier to resect it and avoid a colostomy. We can't guarantee we're going to avoid a colostomy all the time, but in a tumor that's marginal, that might need a colostomy, by doing radiation therapy treatments before the surgery, the tumor could shrink enough that the surgeon could then go in, remove the tumor, and reconnect the rectum and avoid a colostomy.
For more information on this type of cancer or any other cancers, please call Dr. Scott Ackerman at First Coast Oncology, 904-880-5522, or visit us on the web at www.firstcoastoncology.com.